Welcome to the Genius Factory. Enjoy the video.
You start now, open the kit and place everything within reach so you won't interrupt the routine. Once done, wash your hands and disinfect metal tools for 20 to 30 seconds. This prevents cross-contamination. Next, wet the brush lightly and put a pea-sized amount of toothpaste on it. You need just enough to clean effectively without excess foam. Then, position yourself with a mirror and set a 2-minute timer. This ensures consistent coverage across all tooth surfaces. You should brush methodically. Divide your mouth into 4 quadrants and spend 30 seconds on each, using gentle strokes at a 45-degree angle toward the gum line. This dislodges plaque without harming enamel. Once complete, make sure to use floss or an interdental brush between tight contacts. Form a C shape and glide below the gum line to remove trapped debris. After interdental cleaning, clean your tongue with a scraper and rinse. Check the mirror to confirm no residual buildup remains. You finish by thoroughly rinsing your mouth and all reusable tools, then dry and store them in a ventilated case to prevent bacterial growth. Replace your toothbrush or brush head every 3 months or sooner if bristles splay. If you notice bleeding, stop and rinse with warm water, then return with a gentler technique. Bleeding often means inflammation, not failure. If pain or severe swelling persists, stop home care and contact your dentist immediately. Take photos and notes to show during the visit.
Thanks for watching. If you found this helpful, don't forget to like and subscribe.